Let's talk about a little bit about what's going on in the brain.
So the other protein that is involved in Alzheimer's disease, so we think of all of these different dementias as proteinopathies, a fancy way of saying proteins are clumping up, okay? So imagine things clumping up like a piece of crumpled paper. In the case of Alzheimer's, in addition to amyloid, next comes tau. As the amyloid accumulates, it starts breaking down another protein called tau protein. And the tau protein is kind of like the railroad ties on your railroad tracks. Think of the wires of your brain as railroad tracks. Tau helps stabilize those tracks. So when it starts to fall off and clump up, we have a neurofibrillary tangle.
So neurofibrillary tangle, that's one of the classic, that means the brain waves, the interaction there is becoming tangled up?
Yes, well, it's actually the tau protein itself. Think of the railroad ties piling up and clumping up and actually causing a cascade. Instead of just stopping there, it spreads along the tracks.
Wow, wow. And so the train's going to have a wreck, the person's going to have a wreck, everything is not coordinating itself well. So let's go back to understanding both beta amyloid and tau proteins, this proteinopathy, pathology of proteins, clumping of proteins. We can find it. How does that help us?
How does it help us? Well, in order to stop the disease, and I believe we will have a treatment, we need to detect the protein early. So this is why this particular study that is funded via Medicare is revolutionary. It's the first time we have widely available amyloid PET scans so we can detect amyloid in a live person. And if you know the protein, you know how to target that person and treat that person. So it's like waiting for a cancer treatment until autopsy. That's a bad idea. So here we can detect the amyloid and target the amyloid, hopefully earlier and earlier, to stop the disease. That's the goal.
So if you have funding as an investigator, what age are you looking for? At age 40, 45, 50, 55, 60? Anybody that's forgetting things? Because we all forget things. There are normal. So who are you looking for?
In this particular study, the cutoff is age 65. You have to be at least age 65 to participate, as it's funded through Medicare. But ultimately, in the future, I think we'll screen earlier and earlier, just like we screen for a lot of diseases at earlier ages. We don't wait for the symptoms.
Sure. Sure, so we screen for heart disease early, we screen for high blood pressure early, we do mammograms early, we do a lot of things. That's preventive medicine. Do you think there's a chance that if we find early that we can help prevent the illness by maybe getting rid of the amyloid early in life? What's your thoughts?
I believe that we will, especially for the right candidate. Some of the anti-amyloid treatments that are in clinical trial right now are very hopeful, but the key is to treat that person at a very early stage. Waiting for advanced stage is not a good option. So I do believe we'll have the disease-stopping drugs. In terms of when to start screening, I think that will be defined in the future.
Wow. Are we talking about 5 years, 10 years from now?
I think that we'll have a disease-stopping drug within 5 or 10.
I think that gives us so much hope.